welcome to another episode of Tell Us More About That. Today we have my sister's friend, Sarah Balascio. She's a board-certified art therapist.
She's a very, very accomplished board-certified art therapist, and she's working in their wellness center in groups, and she's got a really lengthy history of experience in different fields within mental health. So it was a very enlightening conversation. We learned a lot.
Yeah, she just came out with a book, which we're going to drop in the show notes as well, Art Therapy Directives. It's like a toolkit, I think more geared towards for practitioners, but it sounds like there's a lot of good, approachable material in there for anybody who's interested in the topic. But we covered a lot of really cool stuff.
Yeah.
Getting into just what is art therapy, kind of the history on it, which was really interesting. And then talked about some of the kind of strategies of how art therapy can be useful in assisting in retrieving memories, assisting in dealing with anxiety and stress, and developing mindfulness techniques and
trauma
comfort levels, and associating it with working with people who are dealing with trauma. So all sorts of different takeaways and ground that we covered, but a really, really enlightening educational conversation.
Yeah.
So enjoy this episode 13, I believe. Episode 13 with Sarah Balascio. Welcome back to another episode of Tell Us More About That. Today we have Sarah Balascio. Did I get it?
Got it.
I got it. Okay. So if you could give us an introduction on who you are and your background, and then we can get going.
Yeah, so as you said, I'm Sarah Balascio. I'm a board-certified art therapist. So within the field of art therapy, like other mental health fields, there's different levels of art therapy certification or training. And so I'm board-certified, which is the highest level of art therapy. And for that, for every art therapy degree, you need a master's degree, just like any other field in mental health. And then a certain number of internship hours and supervised hours. And then to become board certified, you need a certain number of working hours, and then you take an exam. So, but art therapy basically is the field of mental health, using art and creativity as a way to kind of further develop your process of expressing yourself. That's basically how I would define it, but you don't have to be an artist to do art therapy. You don't have to have any experience with art making. You don't even have to like art. That's what I tell people. So art therapy is less about creating a masterpiece, and it's more about using the art as a way to further understand your feelings and express yourself. It's just another avenue for developing a conversation or understanding your mental health process with your therapist.
And you are also an adjunct professor?
Yeah, so right now I'm working at William & Mary. I can tell you some of the different jobs I've had and my career path as it's gone, because I know that's usually interesting for people that are thinking about going into the field, like where do art therapists work? Right now I work at the College of William & Mary. What?
Sorry, I cut you off. Where do they come from, art therapists? Yeah.
The heavens, sent from the heavens. So I'll tell you a little bit about that. But currently what I do is I work at the College of William & Mary's Wellness Center. So I facilitate groups and individual sessions, mainly for the students, but also for the faculty and staff. I facilitate a weekly creativity group for faculty, staff, and other employees there. That has been a really big hit. So people come Wednesdays at noon. You don't have to be an artist. And that is more about self-care and taking, like an hour for yourself to be creative, coming together with other colleagues. Within just any field of mental health, there's various topics that you can dive into. And I would say that one is more on the self-care, mindfulness, kind of prevention aspect versus more acute things like trauma and other acute mental health or chronic mental health conditions. So that's what I do at William & Mary. I mostly focus on stress reduction with the students and facilitate a variety of different groups that are free for the students to come to at the Wellness Center, or they can also come for individual sessions. And then in addition, I teach an introductory class on art therapy. In the fall, I teach one called Expressive Arts, which is about all of the other arts and your wellness. So music, movement, writing, and drama. And then in the spring, I teach a more art therapy focused, visual art therapy focused class. So I guess I should back up and explain some of the language that I'm just using, but you'll often hear expressive arts or creative arts therapy used, and that's an umbrella term for those other modalities underneath, like music therapy. Art therapy refers to visual art, drama therapy or dance movement therapy, and then under that umbrella, you get your specific master's degree and clinical training in those subfields. So, yeah.
So when you got your master's degree, is it a master's in
Yeah.
art therapy?
Exactly. Yeah. I went to, so I guess I can tell you how I got here. Basically, I always, all my life, knew I wanted to do something with art and creativity and something with people, but I wasn't sure what. I got my undergrad degree in art and education, and then my first job was actually at the Museum of Fine Arts in Boston, working at a museum's education department. In high school, I had done some different internships in the field of art. One was at Sotheby's auction house, and one was at the Met in New York. And each one of these different things, I liked it, but it wasn't quite perfect. There was things I liked and things I didn't like. Like, for example, while the internship at the Met was a unbelievable, once-in-a-lifetime experience, for me, it was very, very focused on research, and it felt to me isolative. And then, so each different thing I tried, I was like, I liked it, but it's not just right. And so then I became an art teacher living in Vermont. I did that for about 5 years, and I taught K through 8 art. And I liked it, and I felt competent at it. And what I realized, though, from it was what I liked best about being an art teacher wasn't teaching art technique so much as how it made the students feel. So I noticed students that might be like a problem in quotes, in the classroom would be fine in art class. And I started offering open art studio time at recess to my middle school students, which, lunchtime and recess are notoriously tricky times in your adolescence. And a lot of students came and loved it. And I thought to myself, well, there's got to be something to this. So then I went back to school and got a master's degree at Pratt Institute in New York in art therapy. And then, I can then tell you about my career in art therapy too. But that was kind of how I got to art therapy.
Okay, interesting. So it started with, and that's what I was curious about initially, was did it start with therapy, and then you learned about art therapy through your training, or did it start with art? So it started with art first, and kind of connected the dots and found your way there.
Right. Yeah, and people will ask me that too about the art therapy master's degree. You have to have a certain number of psych classes and a certain number of visual art classes to get into the grad program. So, so you have to have kind of 50-50 of each.
That makes sense.
Yeah.
So, coming from my perspective, I'm actually interested because, Jen, you went through a clinical psychology master's program. Do you hear about art therapy like through traditional training? Because I hadn't heard much of it. So I was curious about this.
Yeah, I mean, I knew it existed. I went. I got almost like a dual program. So I did school counseling and counseling, mental health counseling.
Yep.
And it is mentioned along the way, but it's unless you kind of have an eye for that path already.
Right.
There's not much information out there for it.
Yeah. I mean, certainly our traditional therapists like yourself can integrate art therapy into their work after taking some trainings, but to be, a certified art therapist, you need the master's degree. But a lot of people integrate it. Like I integrate other traditional techniques into my work. I do a lot of positive psychology. I do a lot of DBT integrated into my work. So, once you have some experience, it's great to integrate into your practice.
So
Yeah.
what does this look like if you are, I think, like the traditional person who would go to a therapist,
Mm-hmm.
kind of the talk therapy
Mm-hmm.
concept?
Mm-hmm.
Is it the same type of clientele? Like you would have somebody that is just looking to learn some coping strategies, deal with their life stress, or is it a unique population of people that specifically benefits from that type of therapy?
Yeah, let me actually back up and talk about where I've worked and then explain about private practice, what
Yeah.
you're referring to. So most art therapy jobs happen to be at hospitals. So I've mostly worked in inpatient psych hospitals, but they're also at hospitals for like your physical health, especially with children. But most jobs are in cities at large psychiatric hospitals. So my first job out of my master's degree was at a large psychiatric hospital in Vermont. I worked there for 7 years on the adolescent inpatient unit. So teenagers coming in who were in acute mental health crisis, and I would facilitate groups and I planned the daily programming, and I also did individual sessions and met with the treatment team. And then we moved to the New York area for my husband's job, and I worked at New York Presbyterian, which is a really amazing hospital system in New York. I worked at their mental health hospital, and that was a really great experience because they had, they have currently 10 different units, all for different diagnoses, why you would be seeking treatment. So they would have like a mood disorders unit, an eating disorder unit, psychotic disorders unit, and then children, adolescent, geriatric, substance abuse. So all these subtopics, subspecialties, I should say. And when I was there, I floated throughout the hospital. So that was a really great experience because I got to go to every unit and work there. And then when we moved to Williamsburg, where we are now, I worked in private practice and at William and Mary until William and Mary opened up their wellness center and expanded, and I then became full-time there. So yeah, so you would find an art therapist at residential treatment centers. I've also worked at a number of eating disorder treatment centers. So art therapy has been well researched for working with trauma, eating disorders, and memory care facilities. Probably most of the research is out about that. So you'll find art therapists at hospitals, at residential treatment centers, some schools. It's starting to become more prevalent, and then in private practice, like I was saying. So the reason you may not have heard of it, you mentioned that, is because it's newer to the field of psychology. It was really developed in the 1960s. So much newer, formed out of Freud and Jung's work on kind of like symbolic meaning in images and dreams. But in truth, art therapy isn't about symbols. A lot of times people say to me, "Oh, my child always draws guitars." I'm just saying that because there's one behind you. And what does that mean? What does that mean? He's always drawing this. And I would say, I don't know. I don't know your son. So it's not about interpreting symbols. That is kind of a myth about the field of art therapy. While we do have certain diagnostic assessments, just like every field does, it's really about hearing from the person about what it means to them. Now, if I had a child drawing violent things all the time, I would certainly say to them, "Wow, this looks really scary and angry. Is that how you feel?" But people tend to think of art therapy as like these Freudian or Jungian like symbols that get analyzed, and that's not what happens. It's more an avenue to deeper understand yourself and your thoughts and feelings, really. So.
Yeah, that's interesting. Which you just said, it's going to take us down a whole nother road, but I'll be brief with it. But when you
Yeah.
have kids that are drawing things, so like child forensic interviewers, and they're trained
Hmm.
to
Yeah.
get the information from the kid in the safest way possible, is
Yeah.
that something where you have dealt with that as well, of parents coming in and having, whether it's violent images, images, just something that is concerning to them in nature, and they would have you try to like figure out what's going on?
Yeah, so part of our training is also understanding normal developmental artistic skill. So when we're little, we all do this like tadpole drawing of like a big body and then just like legs and arms. And so there's a lot of normal symbols. And then when you see things that are very abnormal, yes, you would then inquire. But sometimes people draw weird stuff all the time. That happens in my groups all the time. And I'll be like thinking, oh, tell me about this. Is it that? And they'll say, no, 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 it's this. And that's when I say, oh, well, you are the expert, not me. You know what I mean? But yes, there are, especially with children, certain kind of developmental standards. And if something stands out, yes, you would dive into that. Yeah.
And this, it was a question that I'm kind of combining two topics right now, but when we're talking about like developmentally appropriate drawings or
Yeah.
interpretations or I don't know, detail maybe.
Yeah.
I work in a K to 5 school right now,
Uh-huh.
and I don't. There's this thing called Skibbity Toilet.
Mm,
It's
know
just
about
like
it.
it's just like a graphic.
I only know because I have a middle schooler. Yeah.
Okay, yeah, and it's but we have like first graders who are seeing these videos online, and it is
Yeah.
just kind of like a disturbing head coming out of a toilet.
Yeah, I haven't quite seen it. I've heard it referenced, but yeah.
So like developmentally, I'd be like, what the heck? Like, why are you drawing this? But then knowing that
Exactly.
there's so much more access to
Yep.
um,
Age
development
inappropriate.
appropriate.
Yeah.
Yeah.
Things. Right. So that's why it's an inquiry, but even that gives you information. Wow, where did you see this? Like, where was your family when you were watching this? Or, tell me about how you found out about this, right? So even that starts the conversation because maybe that kid might not tell you about that, but if he's drawing it, then you can further inquire. Um, yeah, and I think you were starting to ask me, Tony, about can anyone just go to art therapy? That would be a follow up on that. So, yeah, so when I worked in private practice or also at William and Mary, anyone can come to art therapy. You don't need to be an artist. You don't have to have any art skills. As a trained art therapist, I am going to guide the client or the patient in a way that makes them feel comfortable with the mediums. And mediums in art are a very big thing. So if I have a person who's very rigid and type A and afraid to make mistakes, which can often happen at William and Mary because the students are so high achieving, I would not do something in my first session with like, think of a blank piece of paper and a Sharpie pen. I mean, that would be horrible for them, right? So I would give them, lots of guidance, tell them to probably not do anything realistic, give them lots of eraser and ways to mold it and shape it and be a way that makes them feel comfortable. You would have to be very confident to work with just a black Sharpie and no way to alter it. Whereas if you had like, a pencil and eraser and you could sketch, and oftentimes I even tell people to pull up a Google image. If you're trying to create a bird, a robin, go on Google image and you can just Google simple robin drawing, because I don't want, as an art therapist, for you to be focusing on how you can't create a robin. If this is the image that you really want to create and it's important for some reason to you, I want you to be thinking about why and what that means rather than, I can't get this right and it doesn't work. So often in art therapy, we really stick to abstract or use mediums that don't require something to look exactly perfect. When people think of art, they often think of drawing and replicating, and that's the hardest of all the art forms. So there's many mediums that you could use that don't require realistic images, like collage or even photography, or just encouraging abstract work rather than realistic. So unless you're working with an artist and they love to do that, you'll find a lot of teenagers will love to sketch manga style, or they have their things they like to do, and then you can incorporate other elements of your therapeutic work into that. So
Okay, yeah, that makes a lot of sense. So I want to back it up a little bit from the historical perspective on where this came from. You said it's
Mhm.
relatively new, from starting around about the 60s.
Mhm.
What was it that took art and then merged it with this concept of a therapeutic practice? Kind of how did that get going?
Yeah, so there's two women that started the field, which is exciting. Edith Kramer and Margaret Nomberg, and they really came out of that analytical field of psych, studying Freud and Jung. And one of them wanted to focus more on the art making, and one of them wanted to focus more on like the symbolic imagery. So they really forged the way, moving away from just psychoanalysis and integrating actual art making. And some art therapists focus more on the psychological part, like I said, integrating CBT or DBT or other frameworks, and others really just let the art do the work. So, within our field, people have different processes that they focus on. But when you go to a typical session, you will not just sit there and be plopped down with art supplies and say, like, get to it, right? So we would set, just like in any other setting, treatment goals and what you want to accomplish through the sessions. And then you're guided by the art therapist in various directives, it's called, or interventions. So just like any other therapy session, you would set these goals. And at the start of the session, we would talk about that. There's a period of art making and talking. And then at the end, there's a period that's always set at the conclusion for processing the artwork, looking at it with your therapist and sort of understanding it deeper. And then, not to plug too much, but I did just recently publish a book just on this topic, Art Therapy Directives, available on Amazon and Barnes & Noble.
Amazing.
Yeah. So
detail I should have added in the introduction.
Oh, yeah, thank you. So that's okay. I got it right in there. So that's actually exactly what my book is about. As I wanted to create a kind of a manual for art therapists of various topics of what a client might present for. Could be grief, eating disorders, anxiety, depression, whatever, the whole gamut. There's 30 chapters. And within each chapter, there's 4 different directives or interventions that you might do with a client based on that. So I said students at William & Mary who are coming for stress reduction would have a very different art therapy directive or intervention than might someone who's there for PTSD or an eating disorder. So while the mediums transfer and each person has their preferences, the actual focus of your work is more based on the clinical need.
That's amazing. Congratulations.
Yeah, that's incredible.
Thank you.
Congrats. So for scope of the book, is that the target audience? Is it mainly for practitioners, or is it like something for the layman?
No, it's for art therapists and other mental health practitioners like yourself who would like to integrate these techniques into their work. Yeah. Or maybe like interested students, people wanting to learn about art therapy. Yeah.
Yeah. I've obviously heard of art therapy many times, but I am not artistically inclined in almost any way. And so, but I also know, again, just from working with kids, I've worked with from K through 12 at this point, and then college age and young adults. Everybody wants to color, or they want to keep their hands busy, or they want to write or draw.
Right.
Or create. And so I've always just we've done those things in sessions or in our time together, but I would never call it art therapy.
But it's integrating the techniques, definitely. Yeah. And you bring up a good point. This is in my book too, but from my work with eating disorder treatment centers, lot of research out there about nervous and anxious hands, and mediums like knitting and crocheting are really good for that. Also, there's been studies on smoking cessation and taking up things like knitting and crocheting. So there's this also kind of I guess sometimes that might delve into the field of occupational therapy almost, where these things, these techniques aid in a different way, not just psychological, but physiological almost too. What I would say to you, Jen, which I find interesting because I have a lot of people say to me, oh, I could never do that. Nope, can't do it. Or my art teacher.
I would taint the art world with.
Oh, people say that to me all the time. I'm not an artist. I could never be an artist. Or sometimes people have had really mean art teachers, which is more unusual, but because we're normally hippie-ish, peace-loving. Yeah, flowy skirts, etc. Yeah. And but sometimes people have art teachers that were really strict and mean, and it's hard because that was where I differentiated the art teaching part for me. Like, I would have a rubric and certain techniques that needed to be achieved, but then at the same time, when students were adding their own creative flair, that's when it can get tricky as an art teacher. But so as an art therapist, I don't worry about that, which I love. But what I would say to you is I would find it interesting to inquire, like, what does it mean to not be good at something? What would it mean to make something really messy and throw it out? Just give it a go. Hey, what the heck? A lot of times in art therapy, you make stuff and then you just throw it out. You don't even keep it. It was just the process of making it. So,
Sarah, you are good. I do not like making a mess, and if I'm not good at something, I will stop it immediately.
yeah. So that would be a really exciting thing for us to work together on. Like, let's make something really ugly. Oh my God, let's see what's going to happen. And understanding those feelings, right?
Yeah.
And also just sometimes making things just to make them, and then you don't even keep them, and that's okay. A lot of times we make really weird and ugly things in art therapy just to kind of get it out. Sometimes people also will make things that are very intense, and they find a cathartic feeling, and they don't want to keep it, and that was enough. Um, so yeah, it's not. I would say more rarely do people make something that they're like, this is really beautiful, and I want to hang it up. Um, that's like sometimes a really neat byproduct. Like if you're doing a medium like knitting or something, I've had patients in the eating disorder treatment center making an entire blanket while they were there, and it was like partially sensory for them because it's really soothing, and also kept their hands busy when they were really nervous and in meetings and treatment that was uncomfortable. So sometimes it's a beautiful byproduct, but not often, I would say. So
when people come in and you're treating them for like issues that they're struggling with narcissism, are those the people who want to keep their art? Are they the only population? This is good stuff.
Oh, you're funny. No, 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 no. But a lot of times I'll get clients like Jen, and then by a few sessions, they're like, you know what? I actually really like this. And I love seeing that because I'm like, I told you, because it's just a belief in yourself. And you see someone's growth and self esteem build, and they'll be like, wow, this is really cool. And because what I do a lot at William and Mary is less acute work and more prevention. And what I like to talk about a lot there is that anyone can be an artist, and art is a part of your wellness, just like you might say mindfulness is, or exercise, or breath work. And it's just a matter of practicing it. So we can't expect to be artists if you haven't done art since like fifth grade. Like I cannot expect to speak Spanish fluently since I haven't done that since my seventh grade Spanish teacher. So, it's just a matter of doing it more. And the more you do something, you get better at it. I'm very much not in the school of thought of like, you are an artist or you're not, like you're gifted or you're not. It's just like anything. It takes practice. Like you're not going to all of a sudden be able to draw a realistic still life when you haven't done that since the fifth grade.
Yeah. Yeah. You may have touched on this already, but the art component of like the definition of how we're talking about this, is it
hmm
strictly visual art for what you're focused on? Or
Mine is visual. Yeah. So that's what I meant by those umbrella terms. But my graduate program, we had two programs. One was for dance movement therapists and one was for art therapists. And oftentimes they would have us do things together, which as a visual art therapist, all of a sudden having to do like this weird and wild dance movement therapy was very uncomfortable. But you get to see that field and understand it. So a lot of times we do integrate our work, like at New York Presbyterian, there's a large creative arts department, and so sometimes you would have to fill in for someone doing music therapy, and while that's not my specialty, I could integrate some music stuff into my art therapy work. But my particular field, when I say art, refers to visual art therapy.
Okay.
Yeah.
That makes sense.
Yeah.
Did you have something?
Not yet.
Okay, so you had mentioned, I'm going back to the history piece of it because I want to see if there's a connection to this. With
Okay.
the time frame of when it started and kind of the culture and the movement of what was going on in the early to mid 60s,
Yeah.
is there any connection to that was the prime time for when people were studying hallucinogenics and how
hmm
those impacted mental health? Was
hmm
there any connection to like those two at all, or was it just kind of coincidence that the timing was right around the same.
Yeah, there hasn't really been any link really specifically to that, but I would say maybe people just started thinking more outside of the box at that time of traditional psychological techniques, but there isn't no really link to that
Okay.
particularly. But I bet that's when just things started to evolve because that's when people were starting to have more like free thinking in general, right? And so some of these alternative pathways became, I bet, more prominent then.
Yeah.
So,
Interesting. When you mentioned earlier using art therapy for like helping with memory,
memory care,
memory care. Okay, so where we're transitioning into now with the baby boomer population
aging
getting into that
population.
that
Yeah.
that age and Alzheimer's and how prevalent that's becoming, is that something that you're seeing having a pretty significant impact on like quality of life with dementia, Alzheimer's patients?
Yeah, so let me tell you some really interesting stuff about this. This is probably the most well studied population in the field of creative arts therapy. Music therapy is very, very well studied and practiced at um, I don't want to good memory care facilities. So I teach this in my class. We watch a movie called Alive Inside. I recommend it to anybody. It's about a former social worker who goes into memory care facilities throughout the country with just a standard iPod. So this is back kind of, before we all had iPhones and stuff, with music loaded on it to patients that are seemingly almost in a vegetative state, and plays for them some music from their time period. So that's important. You can't just like play like Busta Rhymes, but like from their time period, and they become alive, and they're not just dancing, but they start talking, and they haven't talked in years, and they start talking about old memories and becoming very present, and yeah, and it's unbelievable to see. So he does this movie where he tries to get them in all sorts of facilities. And it's interesting because this one psychiatrist says, we have all these medicines that can help calm agitated patients, because when you have Alzheimer's and dementia and it gets confusing, a lot of times patients can become angry and agitated and confused. So we have all these medicines that can calm them, but there's nothing that brings them alive. There's nothing that creates that spark again inside of them like music. So it's really cool because it's not a medication. It's free. And so it's really an amazing movie, I would suggest. And then another one I show particular to painting and art is called I Remember Better When I Paint. Similar things occur when people in memory care facilities are presented with art materials. Often they come alive, they start talking, sharing old memories, and there's lots of research out there, but this is what I find the most amazing, is that while the brain is deteriorating from the disease, the part of the brain that focuses on creativity is still alive and thriving and can actually grow and continue to develop. It's this one part of the brain that does that, so it's really remarkable. And then now a big thing in the field is having groups from memory care facilities come to museums and have tours and look at the art and talk about the art. So you can get the benefits of art from making art, but also from viewing art. And then, as I discussed, the music and the movement is really huge. So, if I was going to put a relative in a memory care facility, I would make sure they have some sort of creative arts happening there. And it's really simple to even do at home with your own loved ones if they're struggling with that, playing music from their time period, um, you know, or any of their old favorite songs. So, yeah, it's really cool. And it's free.
Yeah,
It has no side effects.
that makes a lot of sense to me. Just the research and the work that's being done with that aging population.
Yeah.
I've kind of always assumed that art therapy was like with children, and
Yep.
so I'm expanding kind of my viewpoint on it.
Yeah,
Just
that's a really common myth, I would say. People think you have to be an artist. People think it's only with children. People think that it's analyzing symbols in art. Those are I would say, the most common um, myths about art therapy.
yeah.
When so kind of the what is the can you speak a little bit more to the science of why me drawing something helps me remember? And my only connection to this is when I used to work for an interview training company, and we would teach the cognitive interview. And one of the pieces of a cognitive interview, if I was talking to like a victim of a sexual assault, and the sexual assault happened 6 months ago, one of the techniques is asking them to, if they're in the position to do this, asking them to actually draw out what they remember. And as they're drawing out, it can bring memories to the surface and things along those lines. What is that? What's happening that when somebody draws, it helps surface information?
Yeah, I think what you're talking about relates to trauma too, which it would be in that experience of what you're sharing, your work. And what art therapy and the creative arts therapies do is take you out of your logical, your head space, and into a feeling place, right? So a lot of times when we've experienced a trauma, we have things that we recall that are sensory, right? Like certain smells or the feelings or the sounds. And so it takes us out of that logical space of trying to remember something and into a feeling space, which brings us alive, I would say, in the dementia case. And also in cases with extreme trauma. So what we know is that it's not beneficial to analyze and replay every detail of the trauma. We now know that, but we do need to process it in some way. So processing it through the art making is a less painful way of our brain being able to process it and our body being able to process it without potentially getting re-triggered. So you do need to work through it, but it's a less traumatic way of rehashing what you've been through. So
it's almost like it's not subconscious, but it almost is, because they're not like sitting with the pain. They're just kind of responding to their emotional position and putting it onto paper.
Yeah, I would say it's more of a feeling place than a kind of intellectual, logical place. Yeah.
Okay.
Yeah.
Interesting.
Yeah, it's almost like they're not trying to find like reason.
Right.
They're just kind of moving emotionally and
Through it.
their
Yeah.
art through it. Yeah.
And then being able to, trauma gets stuck in the body. So a lot of times we'll have symptoms of PTSD that are like heart racing, sweaty palms. And so you're able to then kind of release that through this exploration of, coming back into your body. What does it feel like to briefly have that feeling of sweaty palms and a heart racing? And we can do that briefly, and then we can come back into the present from that without having to be re-triggered. Yeah.
We're talking about coming into the feeling place and kind of bringing it back to the body. Are you finding that creative arts therapy aligns a little bit almost with like somatic?
Yep. So dance movement therapists,
Okay.
that's what dance movement therapists really do. They're the experts in that. And the somatic bodily felt work is deeply what they do. So that is really great for trauma focused work, helping patients reclaim their body in a way that feels safe to them. So a lot of that work is through dance movement therapists. Yeah. They're really the experts in that.
So if you have because art is in the name, so if you have, I feel like that attracts a certain clientele. Like if you are naturally artistic and also am seeking therapy, and I see art therapy, I'm like, this seems to make sense. But I would be interested to see like the population that maybe would not be the standard population.
Yeah.
Like I'm thinking military, law
Yep.
enforcement.
Yep.
That crowd, is there a noticeable impact that they see like pretty quick because they're accessing an area they don't get to?
Yeah, it's interesting that you say that because that's what I actually loved about hospital work, because people would be forced to go to certain groups and I would get people that are like, "Whoa, no, this is not for me." And then they ended up being like the people that like loved it the most. And at William and Mary, we have a program called Flourishing Through Life Transitions, which is a veterans program in collaboration with the business school and the wellness center. And half of the day, it's a certificate program where half of the day, recent transition military folks or people that are about to spend the first half of the day at the business school learning like career stuff, because when you've been in the military, you haven't had a lot of choice, right? So you might not even know where to begin or what the options are or what is interesting to me. So the first half of their day is the career center at the business school, and the second half is at the wellness center doing groups that are facilitated through the wellness center, like things like Reiki, art therapy, yoga therapy. And right, at first, folks might say, like, just like we said, like, no, that's not for me. But then it's interesting to see them really like get out of the comfort zone and say, you'll just see a marked difference. So people say, wow, okay, that was really fun. That felt really good. And they're not sure why, but they know something felt good. Expressive writing is probably the most well-studied creative arts form for veterans transitioning from the military. Writing can be a good avenue to start because it feels a little less like strange or something than art, I would say. Most people are like, I could write something. And it's that same cathartic effect, or being able to process what you've been through and put it out there and process it in a less direct way than someone being like, tell me about that experience. You know, no one really wants to relive it in that much detail because it's so painful. So yeah, that's interesting that you bring that up. It's pretty well studied, and I've had great responses. It's funny because even some of my coworkers were like, "Do you really think like these big military guys are gonna want to like try art therapy?" I'm like, "I do," and it worked, you know. So I get what you're saying though, Tony. It can seem unusual or intimidating or just uncomfortable. Maybe really is the word I'm thinking. Yeah.
Yeah, because I think the stigma is not nearly what it used to be, but
Yeah.
certainly within that community, there is still a stigma of going to see a therapist and what.
Yeah.
I was talking to a buddy this weekend who's a psychologist within the
Yep.
military, and
Yep.
asking him like if I was a special operator and I raised my hand and I said I need to talk to somebody, I'm just dealing with some things, would that impact my ability to maintain my position?
Yeah.
And it doesn't technically, but there are still fringe, I would say, concerns that can come up of the
Yeah.
optics of it.
Yeah.
So I think like within that community specifically, if you've already got this kind of stigma with it, and then you add
Yeah.
on top of it, hey, I want
Yeah.
you to draw me something.
Yeah.
I could imagine that
Yeah.
it's,
Yeah. There are I would say another very large employer of art therapists is the VA. There's lots of job for art therapists at the VA. Yeah. In fact, we one of the sessions I did with it happens in the summer. This program that I'm mentioning at William & Mary, and last summer I asked a few people from the group if you have any interest. We're going to be doing an exhibition of artwork from this program up in DC at the one of the big VA hospitals up there, and a lot of them wanted to share it, and it's now on rotation, and I can share that information with you guys. But yeah, I mean, I think you're right that there's some stigma, but then I think once people try it, it feels good, and I do see that stigma reducing. Especially, like I said, it's been very well researched, and it's at most VA hospitals have some sort of creative arts therapist there. So, yeah,
That's great.
yeah,
I feel like I'm learning so much.
I know this is fascinating.
good.
When you
Well,
talk about making art and observing art,
uh-huh.
when if you were going to go the observation route, so if I was going to come in and have a session and we were going to look at different elements of art, which that's a whole nother thing, like how do you even decide what I would be looking at if I have
Mhm.
no knowledge about art myself?
Mhm.
But do you provide some sort of like direction for the person of, okay, here's what we're going to do. You don't need to know anything. It doesn't need to be some high level intellectual, discovery that you have. Are you just wanting it to kind of trigger and prompt thoughts and feelings and emotions, and then does it turn into like talk therapy at the same time? Like they tell you what they're feeling and what's evoked?
Yeah, so I've never personally used that technique. It's kind of a newer one, especially focused on memory care facilities of getting patients out and coming into a museum. There's probably, I just was looking into this, maybe a handful of art therapists employed by museums where they have groups come to them. But so I wouldn't probably use that technique like in a private practice, maybe in a particular group outing with like a treatment center or, like I said, memory care. But I think what people can get the benefits of art from when visiting a museum relates to, which we haven't talked about here, is the practice of mindfulness. So just really going to a museum, and this is an assignment I do in my class, for 1 hour. Any museum, many of them are free. Pick one piece of art and sit in front of it for 5 minutes and see what it brings up. When's the last time you sat quietly in front of something and just observed it? Its lines, its shapes, the feelings that come up, all the nuances about it. So that's really mindfulness in practice, which we know now has so many benefits to our health. And art making in general is really a mindful practice, whether it's making the art itself or looking at it up on a museum wall. Like if you're making art, you're thinking to yourself, okay, now I'm just gonna shade a little darker here, and now maybe I want to add some pink over here and change the shape here. So it's really that nuanced mindfulness practice. And that's what I find a lot of the students and the faculty and staff who come to my William & Mary groups is they'll say after an hour, oh wow, it felt really good to not have my phone, to not be at my desk, and just for 1 hour focus on this one thing right here in front of me. So I think there's this mindfulness piece that is integrated into a museum visit. So. And certainly social connection. When you're being guided in a museum in a group for memory care, they would say, what so-and-so, what do you think of this? So it's kind of forcing social engagement too, so with that population.
Well, and in a way that they might not engage when talking about a topic. Like
Right,
that.
right. You can say over and over, so-and-so, do you know my name? Right? That's not as exciting as, what do you think is happening in this picture? So it's a different type of question. It's like having a teenager. How was your day? Normal. Um, yeah. So yeah, right. So it's a different way of engaging people. Do you have any last questions?
You mentioned Reiki, which I wasn't expecting.
Uh-huh.
Is that a therapeutic? It's not a therapeutic.
No, so I was just mentioning the different modalities that are at the wellness center. There's yoga therapists, there's art therapists, there's Reiki, massage, um, mindfulness. So those are the main like classes that students can engage in or take advantage of. I can't speak to Reiki. I don't know about it that much. I never even tried it. I always say to my colleague, I'm gonna try this, but I've never tried it yet. So
I'm very intrigued by it.
yeah.
I did have two kind of last things for me at least, and they're probably connected in some way. Where do you see, or has there been any kind of inclusion of technology with art therapy? Because they do kind of seem like they should be separated by
Mhm.
design, but
Yeah.
have there been creative ways that art therapists have been able to lean into technology to make it a lasting experience?
Yeah, well, we were all forced to when COVID happened. I facilitated all my groups virtually, especially at the Eating Disorder Treatment Center I worked at. We did that for a year and a half.
Wow.
So, yeah. So, yeah, so we got really creative in that just coming up with exercises with materials people have at home, which I actually love because I don't want materials availability or access to be a problem. I like that you can do things with just pencil and paper. People were using Post-it notes and just pens they had around. And then it's kind of a delight to come to an art therapist who has this plethora of like clay and fiber art and yarn and sculptural materials and watercolor and paints. So that kind of forced us into it. But yes, there is a whole field. A lot of students will do art on their iPad. Like and this is not my area of expertise, but like digital art on drawing applications. And it's great for teenagers because that is a way into them. But So yeah, there's lots of options. Digital art just doesn't happen to be a medium that I know that much about. But if I've had a number of clients say I'm going to bring my iPad and my um, uh, what is the special thing you draw with? This is how bad I am.
The Apple Pencil.
Yes, and so yeah, so most definitely, yeah. I mean, I still think that's creative. I think cutting out collage materials and putting them together, it was kind of like some of the first ways of taking images, altering them, and making them become yours, which is really similar to doing, digital art.
Yeah. Yeah, that's interesting. The second part to that was, where do you see art therapy going? Like, what is the research directing the future of kind of this practice getting integrated in with like general studies, or just kind of the focus that you see it going?
Yeah, it's interesting that you bring this up. It's kind of a hot topic in our field. A lot of people, because art therapy, which you were talking about going from state to state, Jen, as an art therapist, we have certain states that have licenses for art therapists. I would say there's probably about 15 of them right now. That's just a rough estimate. And so if you're in a state that doesn't have a license for art therapists, you then have to become licensed an LPC or something. And so there's this big divide in our field. That's not that big. I'm over dramatizing it. There's a divide in our field where some people think we are art therapists, we are our own thing. And then some people are saying, because there's programs that are both, like a clinical program with a specialization in art therapy. So, and then some people think then that the art therapy teaching gets like sort of watered down. So there's this divide in our field, but then those people say, well, this is more marketable. I'll be able to get a job as a traditional therapist, and then I can integrate art therapy into it. So there is that. I am really excited more about the states that are getting art therapy licenses for art therapists. I was part of some work on that in the state of Virginia. It's currently held up right now, unfortunately, due to our governor. But prior to him coming in, it was ready to go. So, not to get political, but so each state has their different regulations, and I am licensed in the state of New York because that's where I was working for a while. And the cool thing is I see people virtually in New York, because since COVID that's happened, where as long as the client lives in the state where you're licensed, you can see them. So it's opened up that has been a benefit that opened up with the whole like virtual world, because none of that stuff was really happening before COVID. So I think it's an interesting thing developing in our field. But most importantly, I think just access to it, and which is what state licensing would do, or, the schools that are training both clinical therapists alongside art therapists. So,
yeah, I am going to throw in a ridiculous curveball question that I wanted to ask earlier, if you don't mind, and we can then wrap it up. But you've got all these different venues where art therapy, where you've specifically worked, and it sounds like it would apply. Do you know anything about the research or the efficacy of using art therapy with like an offender population in prisons or with rehabilitation?
Yeah, so art therapists are often in prisons as well. That's another facility where you find an art therapist. Yes.
Okay.
Right. What? Sorry.
I said working in prisons, not.
Oh yeah. No, we're not locked up, most of us. No, yeah, working, right, working. And in fact, drama therapists are have been the most studied in prison work in incarcerated populations. If you know Tim Robbins, the famous actor, he does like the Shakespeare in the prison work, and there's lots out there on that too. This idea of, and talk about people that are resistant to trying this weird stuff. I mean, but if you look at all into Tim Robbins' work on theater and writing in the prison system, it's amazing, because what drama therapy can do is an experience in trying on different roles and playing out different scenarios. So if you're a person that's always done things a certain way in your life, maybe someone who has experienced trauma, had family not there for them, or whatever reason they've wound up in this system, they've probably done things the same way forever. And so this is an experience of role playing a different way. So someone comes up to you in the prison yard and wants to fight you. your instinct would be to fight, but what if you role played a different way to respond? So, what?
To dance.
Yeah. Well, this would be therapeutic work, but this would be drama therapy work rather than dance movement therapy. But it's that idea of playing and trying on different masks, different ideas of who you could be. And a lot of the folks in the Tim Robbins stuff report this idea of being able to get outside of who they have been stereotyped as. You're a criminal, and you're always a criminal. You're the lowest life. And what would it feel like to not be that stereotype? So can you try experiencing that for a little bit? So anyway,
Cool.
interesting stuff. Yeah.
I like that a lot. I'll look for you said Tim Robbins study, or Tim Robbins, the Shake.
He has lots of videos and stuff out there about his work. He's done a lot of volunteering of his time of getting theater work into prison systems through drama therapists. Yeah.
It does sound like the creative arts therapists are already in the venues that they should be in, or
A lot of facilities. Yeah. A lot of group work. Yeah.
Yeah,
Hmm.
that's great.
Yeah.
Do you have anything else?
I don't think so.
That was awesome, man. So
This was good.
Yeah.
Yeah, very enlightening.
It's a
Good.
topic I've never thought about, to be honest, but I'm excited that I've now been introduced to it, and I'd be interested to see how it's incorporated into the program I'm starting in the fall. And
Yeah.
it sounds like something that everyone in the mental health field should at least have some type of knowledge around.
Yeah. Yeah, I think so too. Just like we have a repertoire of, different frameworks from what, field you like, whether it's positive psychology or behavioral or person-centered, it can be just part of your repertoire of
Yeah.
techniques that might click for different people, so.
Sounds like
Yeah.
we have to buy your book.
That's what I was going to say, yeah. That's a perfect-
Available on Amazon and Barnes & Noble.
We'll put a link to it in our
Yeah, that's so
Yeah.
cool.
Well, you guys, this was really great. Thank you.
Yeah, thanks so much for coming on. This was awesome. You were a wealth of information.
Thanks.
Thanks for joining us on another episode of Tell Us More About That. Don't forget to subscribe on whatever platform it is that you're listening to us on, and also leave us a rating and review.
If you have any topics you would like us to consider, if you have any feedback or commentary, only if it's positive, please visit www.tellusmoreaboutthat.com.
Thanks again for joining in, and we will see you next time.
See ya.